Hello, this is Brandon Tidwell, Assistant Director of Human Resources, and today we'll be talking about return to work guidelines for employees during the COVID-19 pandemic. First, I'd like to say welcome back. As we return to campus and to begin this new normal in our workplace, we understand that many employees are concerned about safety as well as the changes to Augustana policies and procedures that we've implemented. We want everyone to be assured that we're taking your concerns and the health and well-being of our employees seriously. This training is a starting point, and additional questions in the conversations are welcome. We anticipate that this guidance will change over time and will keep you updated as changes occur. First, let's talk about what the college is doing to keep employees safe as they return to campus. One of the expectations is that all employees will be taking part in employee health screenings. For employees with a fixed work location, meaning that they work in an office dedicated to themselves, they'll be able to log on each day via a link and self-attest that they've taken their temperature, have not exceeded a temperature of 100.4 degrees, and have not had direct exposure to anyone with COVID-19 or have not had COVID-19 themselves. There will also be several questions about COVID-19 symptoms. As long as the employee has not had the symptoms and is not exhibiting a fever or chills, they'll be allowed to continue on-campus work. For employees who do not have a fixed work location and travel across campus throughout the day to multiple locations, they'll be checking in with public safety at the beginning of their shift to do a temperature check and the health screening questions. This process is expected for all employees and visitors and is meant to keep all employees and campus community members safe. Employees returning to work will also notice increased cleaning standards and expectations. Common areas and frequently touched surfaces are being cleaned daily. Cleaning supplies will be available, and employees are encouraged to clean and disinfect their own workspaces throughout the work day. Hand sanitizer is provided throughout the buildings as well. We've had previous locations of hand sanitizer, but we've also added many more locations throughout different buildings. Our goal is to make sure that a hand sanitizer location is located within the entrance of each building or within a few feet of each entrance for each building. Posters and communication are displayed with reminders on how to prevent the spread of germs. Also, posters and communication will be available to remind employees about the importance of social distancing, hygiene, hand washing, and also making sure that appropriate spaces are used with new capacity limits. Directional signage will also be posted to highlight hallways and stairways that may be marked as one directional to reduce face-to-face traffic. Additional ways that the college is implementing safe working procedures are changing work hours. Many employees will be working staggered work shifts to reduce the number of people in the building at one time. Workspace layouts and seating arrangements are being revised to allow for social distancing. Common areas such as meeting rooms, break rooms, and other communal areas will have reduced seating and capacity limits. And shared items such as coffee pots, microwaves, and equipment should be wiped down and sanitized before others are using them. You'll also notice that only select water fountains with water bottle fillers remain operable to assist with eliminating the spread of the virus. What should you do in order to help keep yourself safe? Number one, stay at home or go home if you're feeling sick. Maintain social distancing practices in the workplace. Follow cleaning product instructions when cleaning your work areas. Wash your hands frequently or use hand sanitizer. Cover your nose and mouth when sneezing or coughing. Avoid touching your face. Wear a face covering when you're in common areas or around others. Replace handshakes with head nods and waves. Avoid using other employees' phones, desks, offices, and other work tools and equipment when possible. And talk to human resources if you have concerns specific to your circumstances, such as a health condition that places you or someone in your household at high risk. And last but not least, be kind. Understand that this is a stressful time for everyone, and an extra bit of kindness right now can go a long way. Next, let's talk about wearing a cloth face covering or a mask. Before putting on a face covering, be sure to wash your hands with soap and water or utilize an alcohol-based hand sanitizer. Cover your mouth and nose, and be sure that the face covering fits snugly and that there are no gaps between your face and the face covering. Secure your face mask with ties or ear loops depending upon the type of face mask that you have. According to the CDC, a face mask or face covering should include multiple layers of breathable fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damage or change to the shape of the face mask or face covering. When removing your face covering, be careful not to touch your eyes, nose, and mouth, and wash your hands immediately after removing. Note, the face coverings recommended are not surgical masks or N95 mask respirators. Disposable face coverings are for single use and should be discarded at the end of each use. It's recommended that employees have 5 face masks so that they can change out their face coverings regularly and have one for each day. It's imperative that they be laundered every single day before coming to work. Next, let's discuss some frequently asked questions. Can I continue to work from home? By the beginning of fall term, we expect most all employees to resume on-campus work. As we ask employees to return to campus work, we will be working through individual situations or barriers. Is it safe to return to work? We're taking every precaution to ensure our workplace is safe. We're following federal and health and safety guidelines as well as guidance from our state and local governments. We're implementing practices such as employee health screenings and social distancing to keep our employees and workplace healthy. Do I have to answer medical questions when reporting to work? Yes. All employees and visitors will be required to answer questions regarding COVID-19 symptoms before entering our buildings or complete a virtual screening. Individuals who refuse to answer health screening questions will not be allowed to work. What should I do if I feel sick? Employees who feel ill or have symptoms including fever, chills, cough, or sneezing should notify their supervisor and leave the campus. Employees can utilize accrued paid time off hours and other paid time leave that may be available. Contact Human Resources for more information on available paid time off options. Do I have to wear a mask at work? Yes, we're asking all employees to wear face coverings in common areas and when interacting with others. If you do not have a face mask, the college can provide one to you, and you should launder it on a regular basis. If you have a medical condition that restricts you from wearing a face covering, please speak with Human Resources. Will we continue to have in-person meetings? In order to promote social distancing in the workplace, most meetings will be held virtually or in smaller than usual groups. Whenever possible, we would encourage meetings to happen virtually to promote social distancing. How will positive cases of COVID-19 be handled in the workplace? Despite all precautionary measures, there is always a risk of workplace exposure to communicable diseases. Should an employee contract COVID-19 and expose others in our workplace, we'll immediately inform all employees of the possible exposure. Employees who have been potentially exposed will be sent home and asked to telework for 14 days. A thorough cleaning of the workspace used by the infected individual will be conducted after the area has been closed off for at least 24 hours. According to HIPAA laws, the identity of the infected employee will not be shared in order to protect their privacy. Thank you for taking the time to complete our COVID-19 Return to Work training. We would ask that if you have any further questions or concerns to please reach out to any member of the Human Resources team.